In the name of God, most gracious, most merciful, we welcome our speakers in the press conference for the National Taskforce for Combating Coronavirus, COVID-19. His Excellency Dr. Walid Al-Mana, Under Secretary of the Ministry of Health, Ms. Imana Dosri, Under Secretary of the Ministry of Industry, Commerce and Tourism for Trade Affairs, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, member of the National Task Force for Combating Coronavirus, Dr. Jamila Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on the YouTube channel of the Ministry of Health via its website in 5 different languages. And we also have the journalists and reporters joining us remotely. Now we begin with Dr. Walid Al-Mana, Under Secretary of the Ministry of Health. And then God, most gracious, most merciful, praise be to the Lord. We praise him for his unlimited blessings, and may God's peace and mercy be upon his prophet. We would like to welcome all of you to this press conference in which we would like to update you on all the information on how to deal with coronavirus in the Kingdom of Bahrain. We always emphasize that the Ministry of Health and the National Task Force and all the competent authorities are continuing to safeguard the health and safety of everyone based on the recommendations of the Ministry of the Task Force to resume the operations of the businesses and industrial places, take into consideration wearing the face mask by employees and customers inside these premises, and to resume the non-essential medical services. Before it was for the essential, now also non-essential medical services can resume operations, and also to allow professional sports players to resume their sport exercises in outdoor spaces and swimming pools, and also to allow outdoor cinemas to operate as long as health and social distancing guidelines are followed, and to close the indoor cinemas. And also, as of Wednesday, 27th of May, to reopen all salons and hair barbers while ensuring health and social distancing guidelines are followed. And we would like to emphasize that everyone should follow the instructions and guidelines to protect the health and safety of everyone. And now I'll leave the floor to Ms. Iman Al-Dosari to give you this information and details. Now we are going to reach the Eid day, and we are on Friday, the last Friday of Ramadan, and we congratulate the leadership, His Majesty, may God protect him, and also His Royal Highness the Prime Minister and His Royal Highness the Crown Prince, and to all the Bahraini people and all residents on the upcoming Eid, the blessed Eid. May Allah return this day to everyone in good health. Now, coming to Eid al-Fitr, we would like to confirm that all the citizens and residents should follow the guidelines and instructions, and we should not take this. We should emphasize that we shall not visit families so that the number shall not increase, and that the curfew, the idea of the curfew is not in line with the current situation. We always say that there is a possibility with the information, with the measurement indicators. So imposing a curfew is not in line with the current situation. that we are assessing day by day. So all what we're asking to have the members of the society to take into consideration the social distancing and wearing face masks. In the Kingdom of Bahrain generally, we started with this problem over 3 months. And I think we have concluded with wide experience, with much information about the type of this virus and how to deal with it, and the number of people admitted to hospital, and also for those who need intensive care. And we have gained much information based on which we have built indicators to assess the situation. So the curfew is always in mind and people are mentioning it, but our indicators, our assessment say that uh, we were not going to impose a curfew because assessing the situation, as we repeat, shows that we don't need curfew. So encourage everyone to do greetings virtually instead of physical gatherings, and to transfer ideas electronically. So I would like also to thank the Central Bank of Bahrain and to Benefit Pay and to all banks for providing all the facilities necessary to facilitate the electronic payments. We affirm that the Ministry of Health would conduct further tests in order to reach out the active cases so that immediately to isolate them. Now we've reached over 262,000 tests. We always emphasize to call 444 whenever you have symptoms, because the protection is much better than cure. So we have these services to help you, and we're always increasing the capacities. We also emphasize to quickly report any symptoms because that helps to isolate the active cases and to limit the number of the contacts and to quickly provide treatment, because it is very, very important. We need awareness. Whenever you have symptoms, please report it quickly, because if you report it late, it might not be able to provide treatment. Also, the national efforts are continuous to deal with COVID-19. We have increased the capacity for isolation and quarantine centers. So these are proactive plans. The capacity for isolation and treatment now is 6,451, of which 4,289 are occupied. As for the capacity of the quarantine centers, stands at 2,930, of which 403 beds are occupied. These numbers we're going to see changing in accordance with the needs, while whether for quarantine or for isolation. These figures are changing according to plans, so we implement them accordingly. We emphasize again that spreading awareness is the responsibility of everyone, not only the National Task Force or the Minister of Health. So with the public awareness, with sensing the risk of this virus, we're going by God, we're going to overcome this challenge. Now I'll leave the floor to Ms. Imana Dosari, Undersecretary of the Ministry of Industry, Commerce, and Tourism for Trade Affairs. In the name of God, most gracious, most merciful. At the beginning, I'd like to express my sincere congratulations to His Majesty, the King of the Kingdom of Bahrain, and also His Royal Highness, the Prime Minister, and to His Royal Highness, the Crown Prince, Deputy Supreme Commander, and First Deputy Prime Minister, and to everyone living in this homeland. May God return this uh, with goodness. At the beginning, we would like to emphasize that all the efforts are going to continue and that all the markets and malls are going to operate and to take into consideration the guidelines, and these shops should follow the precautionary measures. On top of them is social distancing guidelines to protect the health and safety of everyone in the Kingdom of Bahrain. And based on the recommendations of the National Task Force, we emphasize the following: to continue resume the operations of the commercial and industrial businesses, taking into consideration the following: all employees and customers are required to wear face and to reduce the number of individuals using the facilities at any one time, to regularly disinfect stores and facilities, and to businesses must place appropriately spaced floor markings for queuing, and that outdoor cinemas are allowed to operate as long as health and social distancing guidelines are followed, while closing the indoor cinemas. And also to allow professional sports players to resume their sport exercises in outdoor spaces and swimming pools as long as health and social distancing guidelines are followed, and to check the temperature before entering the sports facilities, and not to use any shared equipment or facilities like saunas, and not to mingle with all and to keep the the social distancing of the gatherings of less of more than 5 people. And also, as of next Wednesday, 27th of May, all salons and hair barbers are to reopen while ensuring health and social distancing guidelines are followed, to allow the customers with appointment and to close the waiting areas, to keep 2 meters between customers and to reduce the number of employees as much as possible. Third, to wear face masks and protections, and and the masks and gloves, unless when later can be removed, and to not use the hair dryers, and not use microblading, eyelashes, also the not to provide food for drinking, and customers can provide their own drinking and water, and to replace all the equipment of the removable hair tools and to disinfect them, and to continue closing all the entertainment and recreational activities, and to limit the food restaurants and be limited to take out and delivery only, and to allow only the first hours grocery for the elderly and pregnant women, and to continue closing shishas and weddings halls. And the Minister of Commerce and Tourism would emphasize that all the inspection operations will continue and will be intensified to limit the spread of coronavirus. And we would like to ask citizens and residents to report any violations, and we hope that everyone will follow the guidelines and instructions and to implement them to safeguard the health and safety of everyone. Now I'll leave the floor to Lieutenant Colonel Dr. Manaf Al-Qahtani. Thank you very much, Ms. Iman Al-Dosari, in the name of God, most gracious, most merciful. Good afternoon to everyone. Uh, Now we are in facing the challenge of coronavirus for 4 months, and maybe the lesson is that taking the precautionary measures hope and are very important, and they are the treatment for the upcoming period for all the uh, residents and humans around the world and the Kingdom of Bahrain. Your National Task Force is working with all their best, but the uh, God decides. That's why we ask everyone to follow the instructions and guidelines of your National Task Force with the end of Ramadan. And this is the best time, as Dr. Walid and Mana mentioned, to appreciate the value of solidarity and to keep in mind the social distancing and wearing face masks and to limit and to avoid the gatherings. Among the blessings of this month, we have over 3,873 cases recovered and discharged, and with the development of the treatment protocols and the lab protocols, everyone knows we have built the lab capacity. And now, to emphasize, as mentioned by Dr. Walid Al Mana, thank God we have reached over 262,000 tests. That shows the quick identification of cases and the quick treatment. But we have to call upon all citizens and residents to and to educate them to call for whenever they suspect any symptoms in this period. And as we're talking about the lab tests, I would like to talk about some of the indicators that would have an impact on these results, and it's important to know them. The amount of the virus within the human being body, and it has great impact, uh, and also the symptoms. Are they coming late or from the beginning of the disease? We always keep this in mind when looking at the results. And finally, the type and the genetic type of the virus and how they change. So these change and have an impact on the results of the test. So we are counting the Kingdom of Bahrain on PCR tests. They are accredited globally, and we have other types of tests as well. The information of the patient, the blood tests, and taking other precautionary measures, for example, reconducting the tests for like 24 hours to ensure that their body lack the virus. And we always emphasize whether positive or negative test results. It is important to take all and follow all the measures and to isolate yourself and to immediately call 444 whenever your medical situation changes. So the conclusion, anyone with symptoms of COVID-19 that we talked about before, to take all the precautionary measures in order not to transmit and transfer these symptoms, whether positive or negative, while keeping in mind the instructions and contacting 444. And also, among the good news, for 4 months, we are still continuing to expand the training for all the medical cadres and teams, and we are ready for all the scenarios, and we have all the equipment and medication available. So we have trained over 1,500 of doctors and nurses and other medical staff on how to deal with coronavirus and how to deal with critical cases using the ventilators if needed. And thank God, if we count the cases entering the intensive care units, they are really low. So thank God, this is a good point, and we are going to work together hand by hand. And we always remember the lesson is that the taking the precautionaries, believing in God, and having hope, and with our patience and determination, if not achieved in this Eid al-Fitr, we're going to achieve it by Eid al-Adha. And now I'll leave the floor to my colleague, Dr. Jamila Salman, to inform us of the recent updates on coronavirus. Thank you, Dr. Manaf. Peace be upon you all. Just would like to emphasize to continue following the instructions and guidelines issued by the authorities concerned by the Ministry of Health, especially with over the coming Eids and maybe with reopening the salons over the forthcoming period, 4 days. And I thank all the national efforts who collaborated of medical team, those working at the front line, all the staff of the ministries, the Ministry of Interior, the BDF, with the citizens and residents in order to limit the new cases of COVID-19. And compared to other countries, we are in a better situation. As for the health condition, as mentioned by Dr. Manaf, the active cases we have at this time are 4,289. Most of them are stable. They don't need treatment. Only 26 cases receiving treatment and only 7 critical. And they are followed and under the supervision of medical team 24 hours. And we are implementing all the new medical treatments in line with the updates and research around the world. Now, for the recovered are 3,873, whether going out from the quarantine or isolation. They have gone back to their normal life. Just to emphasize, reopening the salons and hair barbers, we emphasize on following the instructions and guidelines to wear face masks and to face covers, and also customers also should wear face masks. And hopefully this would limit the cases, God forbid, if we have. And these measures are integrated with the previous measures in terms of personal hygiene, disinfection and washing hands, cleaning and disinfecting the surfaces, and anyone with symptoms that could be indicators of COVID-19 should contact the authorities. As for at the end, I'd like on the celebration of the Eid, I would like to express my highest gratitude and appreciation to the wise leadership and to the people of Bahrain, and may God return this with better situation, and may the coming days be better and better. And we would like from everyone to strictly follow these instructions, to take into consideration the social distancing, and to limit the gatherings to the small gatherings of the small family who are living within the same household, and to use the virtual greetings. It is very important that the message to everyone we have learned now. We have learned so many lessons from coronavirus, but we count on the awareness of the society and that everyone of us is responsible socially, individually. We need to decide whether if we're going to a certain place, how to use the protective measures. This balance of having our normal life to go normal, and at the same time to follow and implement these guidelines. This is going to have this balanced equation and to limit the cases. Even the global organizations, the World Health Organizations, they have issued certain instructions to cope with COVID-19 because it's going to live with us for a long period of time. So that's why we need to implement these instructions and guidelines, and hopefully we're going to overpass this and overcome this challenge. Thank you very much, the speakers, for your briefs. And now we're going to have the questions from the journalists and reporters who are following us and watching us remotely. Now, question number one from Al Arabiya channel, Muhammad Asai to Dr. Walid Al-Mani. Not closing the shops and to reopening the salons and some activities, seeing the and coming with the period of increase in the number, wouldn't that really lead to an increase in the number of the cases? And does that show any sign of disappointment? Thank you very much for the question. It has many points. Well, changing the methodology of opening and closing, and also related to the increase on the number of the cases on a daily basis, we emphasize that the numbers are one of the indicators among other indicators. So the numbers are not, and our readiness is not counting on the numbers. There are other indicators as well that are related to the spread of the virus. There are indicators related to the compliance of the people. There are indicators related to uh, following and amending the charts. So if we're talking about the numbers, we can say that we have an increase in the number of the recovered people. So all I'm saying is that we cannot relate our opening and closing policies to one indicator and deciding on that. The National Task Force, I would like to affirm that we are working based on transparent methodologies and methods, and these procedures are dynamic based on the indicators. Now, our indicators show that we can continue opening up. Is this a sign of disappointment? No, we're not working with the signs of giving up. We have strength, and we're facing this virus. It is never with disappointment. We have a methodology in the Kingdom of Bahrain with extensive study and with clear and correct signs and indicators. Question from Bana Rasha Al-Ibrahimi to Iman Al-Dosari. The question requires further clarifications on the procedures on salons and hair barbers in case they resume their operations and services, and how to conduct the inspections, as I mentioned in my brief, and also Dr. Jamil Salman about the health requirements for these shops and barbers. It is important that they ensure the safety and health of the workers and the customers. So it's important for us. As for the inspection is going to be continuous by the authorities concerned. Thank you. Question to Dr. Walid Al-Mana from Ibrahim Al-Raqaimi, Al-Watan newspaper. When are we going to open mosques, and would reopening the barbers show a sign of coping with the virus or the end of this disaster? This problem is going to end. Well, we hope to reopen mosques soon. We wish that, but what I would like to affirm that the medical team should assess the situation and to increase the precautionary measures and all the social interactions are in line with the guidelines. As for the opening and reopening of the mosques, it's not a decision limited to the Ministry of Health or the National Task Force. It's also for the Supreme Council of Islamic Affairs. We hope that, but the decision is for the Supreme Council of Islamic Affairs. As for coping, hopefully, or is it better? Well, we hope that this is of both sides. Coping is not giving up. It is important to know that we did not reach disappointment or lost hope. No, we are strong enough with our knowledge. We have conducted 262,000 tests. We have received many patients. We dealt with them, and with the efforts of the doctors, we have many people recovered. The information with the large information, a large amount of information, we yes, people should cope, but they cope with strength, with awareness, and it does not show giving up. No. So this is the difference. Yes, everyone should cope. This is the period we're going to live with, but the credit for the Kingdom of Bahrain, we're living with information, with awareness, with the right way. It's not giving up. So thank God, these blessings are going to continue, and our health is going to be better. But it's important around the world to cope with this virus. Same question to you, Dr. Walid. Rashid Al from the Bilal newspaper. The Ministry of Health bought two robots from France to reduce the contacts between the medical team and the patients. What is the average cost of each robot? Well, with the daily use, technology is very important to be leveraged to combat this virus. And maybe it's not only for the Kingdom of Bahrain, it has been implemented in other countries, and it's been used to reduce the contacts between the medical team and the patients. So these robots are checking temperatures and maybe certain guidelines and messages to provide meals, to provide basic care for patients. They're going to be added to the services for the quarantine and isolation. Well, the cost, the contract, thank God that the company dealt with us, and it is a trial. We're using them as a trial, and are they really effective? Are they going to add great value? So it is an opportunity to enhance and leverage these robots. We still don't have the cost, but once the benefit expected are there, I think the cost is not going to be a problem. And we have a blessing by having our leadership. We have been given a lot without taking into consideration the cost, because the value of the individuals are much than the financial cost. Question from Mahmoud Rafiq, Chief Editor in the 24/7 News. The Minister, His Excellency, the Minister for the Commerce and Industry and Tourism said it's going to be available for 6 months. What is the update? The food stocks are available, thank God, based on the recommendations of the Crown Prince, Deputy Supreme Commander, and First Deputy Prime Minister to provide food stocks for 6 months. We are receiving the agreed upon food stocks and items in coordination with the suppliers, so the food stocks are continuous for this project. Thank you. Doctor, question to Dr. Mana Naila Barakat from Bana 27 News. Despite the warnings by the media in different languages on getting to avoid the gloves and masks, some responsible people are going of not throwing these gloves and masks. Some people, responsible people, are throwing some gloves and face masks on the ground. So wearing face masks have certain ways, and also how to dispose them have certain ways. So this virus is not like any other viruses or the corona types of viruses. So they are available more on the surfaces for a longer period of time. That's why they stay for a longer time if we compare them to other viruses. And that's why, in order to deal with these gloves and face masks, once we remove them from hand and face, it should be from inside outside, and they have to be thrown in the appropriate places, and that ground is not the appropriate place. That requires awareness, education from all parties, government, entities. Also, the masks, once we remove them, they shall not be thrown on the ground or any other place where people can use them or touch them. So we dispose them in the appropriate place, and more importantly, to wash hands regularly. As for the procedures, we're going to report this problem to the National Taskforce, and we're going to decide upon that accordingly. Question to Dr. Jamila from Ahmed Al Hamid from Akhbar Al Khalij. With the increased number of the recovered cases, can we confirm that the Kingdom of Bahrain has passed the top point, and now we're going into the recovery level? Well, the question has always been repeated, not only at the level of the Kingdom of Bahrain, but also around the world. When is when are we going to feel comfortable? Well, reaching the top has nothing to do with the recovery, but it is indirectly. But reaching the top and then decreasing, we're using different models, and it has to do with certain elements. The incubation period of the disease, 14 days, the ability of the virus, the reproduction number, to what extent that this virus can transmit to other people, the daily active cases, and also the death cases. Are they going up or down? And also the number of the tests conducted. The more tests conducted, we in the Kingdom of Bahrain, we are among the top countries conducting tests. And last point, the capacity of the country. So all these elements should decide to what extent are we going to be lead to the top, and maybe then reducing the numbers, and maybe an important element to what extent people are complying to the instructions and guidelines, wearing face masks. All of these would reflect on the new active cases. If we're working hard to comply with these instructions, we're going to reduce the active cases. And still, we are among the best top countries following the instructions. And hopefully, this is going to be a short period of time, and we're going to have these figures reduced. Question to Dr. Manaf from GDN. Ghazi, what are the standards to provide plasma treatment? Do we have the initial results? I would like to confirm that we're going to announce the initial results of the study for plasma soon. We have done it in coordination with Irish University and the Minister of Health and the BDF as well. So we are finalizing the study with the patients, but yes, there are measures implemented to provide plasma. Among them, that the person provided the recovered case, or, uh, they approved to donate their plasma and other uh, measures, and that they have passed 14 days. The longer the days, the better, because the antibodies within the body are going to be stronger. The results so far showed that they are they are good. We're going to announce them soon in the coming press conferences. Thank you very much, the speakers, for their briefs and answering the questions. And thank you. We thank the journalists and reporters. And before concluding, we would like to remind you on following the instructions and guidelines to reduce the spread of COVID-19. Thank you very much for listening and watching.